we're not in the cold weather that we've been stuck in for the last few months, that you and I are, we're at a tiki hut sitting on the beach down in Cabo, and we're having a couple beers and just let's unpack an idea. Let's say, and bear with me, let me kind of explain where my head's at. Let's say you and I are working with a private equity firm, and
Mhm.
working with them, we just acquired 3 mid-tier regional clubs. Solid communities, traditional access models, treadmills, strength floor, group fitness, personal training. You get the setup. Okay. The same model that's existed for decades. You and I, we've been discussing, because we're buddies, we've seen a shift in the market, and we think there's this huge opportunity. We all know healthcare in this country is overwhelmed. Employers are desperate to reduce spend, and providers now are writing a lot more than they used to in the past, these what we're calling letters of medical necessity for structured exercise programs, strength training, metabolic intervention, fall prevention, MSK support, and so on. But there's no scalable, operationally mature execution partner on our side anywhere.
No.
So the question becomes, can a traditional access-based club evolve into something more accountable? Can we continue selling access, community, energy, memberships, all the things that you and I have done for years, while also building an outcomes driven execution layer? Your thoughts?
It can happen. I think based on being in the industry for, quite a while now and being in the thick of it myself, being an operator of 5 clubs, we're not even close. And I say that basically for the reasons you were just kind of talking about is that we don't have a scalable method, to take those letters of medical necessity and those referrals. There's no systematic approach to what we're going to do with that client if they were referred. So that's the biggest thing. If we don't simplify that process, it's impossible.
From a let's dig in. I guess from a healthcare standpoint, I've played in both realms, so I understand what documentation and accountability looks like. From an operator standpoint, you know what culture, coaching viability, or variability, I should say, real world execution looks like, especially when we're talking about fitness professionals, personal trainers, that whole thing.
Mhm.
So I want to wrestle with you this. No, never mind. I don't want to actually wrestle because you'll just pin me and it won't be any fun.
That's a giant, mental giant, man. This is all no go. Okay.
Yeah. Well, we're looking at these 3 clubs, and let's say we're serious about repositioning these 3 clubs to operate in both worlds, access and outcomes. And I'm trying to think, you just said we're not even close to there. So I'm trying to wonder what would actually have to change. So I guess what are your initial thoughts? What do you think would need to change?
Yeah, from the intake process all the way through the prescription process, if we want to call it like a medical, a fitness prescription. That intake process, it is completely different every club you walk into. Every single one. There's a different questionnaire. There's a different process. There's a different tour. I kind of call it touritis now. It's just, I mean, we're doing these features based, you know, processes when you get into a club. And at this point, we're all the same. We have all the same equipment, all the same treadmills. We have the same therapies. We have red light. We get, 24-hour access. We got cold plunges. We got cryo. We got all this stuff. Everybody has that stuff. So it just falls to the bottom line of who's the cheapest, and I do say cheapest, and I don't mean least expensive, I mean cheapest. Um, that's the problem is just yeah, I'll use Dennis Mathias, one of my buddies on the team over here at Ramp, is to line them up, sign them up. That has to be done, right? I mean, obviously there's going to be access people. People are just coming in, they just want access. I understand that. But to get further into outcomes based, if you want to say the word outcomes and be an outcomes based model, there has to be a system from stem to stern. It has to happen. It's not optional, especially in the medical space. I mean, when's the last time you went into a doctor's office and they said, "Hey, before we get working on you, let's take a tour of the facility." You know what I mean? Like, so we're so different, right? And we're expected to be, taken seriously. We do serious work. We obviously we're the metabolic technicians, right? But when the medical world's looking at us like, well, why is the process not start out with the outcome in mind? Why is it features?
That's a good point. I think the industry is stuck in a natural evolution from where we began in the 70s and 80s
Yeah,
to today. So it's still largely, here's the features, here's the benefits. Jump on the tour bus. I'm going to take you around the facility. I call it the tour bus tour because it's really
yeah,
not.
it's crazy.
And it
How great, how look how
and
new Incredibles are. Yeah,
well, this is where I'm struggling is the mid tier is getting squeezed from both sides. You
and I
have
I
the H.
am that, by the way. I am mid tier. I'm rebranded Gold's Gym, so I am. You are
Yeah,
talking
you've
about me.
got 5 clubs, traditionally probably 8 to 12,000 square foot each location. And I'm guessing,
Up to 25.
okay, so, and I'm guessing 12 to 1,800 members a location.
Yeah,
Yeah.
yeah, yeah.
So
You've done
you're
this
in that
before.
mid tier space getting the
I am.
squeeze from both
I
sides.
I am he.
So you are perfect for this conversation, my friend.
Thank you.
I come from the
I still don't
Golds, the
know what I'm doing,
Worlds.
but thank you.
I'm from the same space. All the clubs I own were mid tier. I come from Golds, Powerhouse, Worlds. That's the space I played in. And I'm seeing a death of the mid tier, but I think there's an opportunity because the mid tier is stuck in the old ways. You've HVLP on one side, luxury high end on the other.
Yep.
And there's a space in the middle where people continue to want to go to these mid tiers because there's a different type of experience. There's a different type of culture. There's a different set of amenities and services that are typically provided in this mid tier that fit my budget, my needs, my desires, and the experiences that I'm looking for. I'm not going to get it in the HVLP necessarily. And I'm definitely not going to pay 150 to 200 bucks a month to go up to the luxury brand because I don't know. I don't care about that much.
Yeah, I'll bring my
So
hotel room.
there's this space, and we know there are clubs like this sprinkled throughout the entire country that are sitting there desperate for help. And I'm trying to fast forward and look into the future and see HVLP is trying to evolve in their own right to almost look like and act like a mid tier, but they've got a price sensitive consumer that's
Mhm.
joined and flooded their clubs that good luck. Good luck getting a $10 a month member to want to buy a $5 shake.
Right.
Or if you're in an HVLP and you're a personal training manager and you're banging your head against a wall trying to figure out why your penetration rate's so small, look at your starting point with the cost conscious consumer, and then you're trying to upsell them to a 50, 60, $90 an hour training session, and they're all
Not gonna happen.
balking. I
Not
can't
gonna
get
happen.
above 1%. Well, that's because it started at a price sensitive consumer versus the mid tier. We get a $40 a month, $50 a month consumer in the door. They're willing to drop, $3 on a pre-workout, $5 on a post-workout. They're looking for bars. They're looking for meal plans. They're looking for trainers. They're looking for assistance. They're looking for a different type of experience.
Totally agree.
Now, what I'm thinking though is they're the ones though that are best positioned to start thinking about this marriage to the healthcare side. Um, you had mentioned earlier, now that I went off on that diatribe and verbal vomit, sorry.
Oh, I loved it. It was so spot on, though. It's vindicating. It's like, I'm the guy in the middle. You're talking to me right now. It's great.
Dude, I understand more about the space you're in right now than you can imagine.
Tough
It's where my
spot.
head is consistently stuck at. And I see this thesis and I'm trying to kind of unpack it with buddies, friends, experienced operators out in that space because I think there's something there that
Agree.
private equity is missing. And it
Hmm.
just takes the right experienced executives to come forward with this thesis and go, I think there's an opportunity here. So let's
Yeah,
unpack
totally.
that. You talked about a physician writes Patient requires structured resistance training 3 times a week to improve metabolic markers and reduce risk falls. This patient
Mhm.
walks in the door. We have no intake. We have no onboarding. We have no processes, systems, or anything in place. But that doesn't mean that we can't. So,
I mean, it happens all the time. I mean, throw a hook in the water with no bait on it, you're eventually going to catch something. But if the process and setting up the system would be a much, more successful way to do it, right? Obviously, you agree with that.
yeah, I mean, standardize onboarding
Yes.
through an EHR that's tied in easily with those providers. We go out in the community and we build a referral network with those providers. So they're referring in. They're giving us medical letters of necessity that is clearly describing exactly what the expectations are. We've already
Hmm.
had conversations with these providers, so they understand the angle that we're coming from. Then it becomes kind of your wheelhouse, coach education. Let's maybe, before we get into program tracks and data capture and systems discipline, all that, co- coach education. So I understand we're going to need medical director oversight
Hmm.
so that it becomes compliant, and then we can capture reimbursable events. We can actually probably bill for certain CPT codes from our clubs,
Hmm.
capture and monetize this whole thing, which is going to be attracted to PE and us. But it kind of all begins with, that first 90 days, we're going to go in, and I imagine you want to go and work with the trainers, the coaches, and educate them. Where do you think that starts?
Oh gosh, where to begin? I mean, I already have the end in mind with what we're using, and obviously, I'll just shameless plug to start this out. I don't really have to educate my coaches any more than just learning the ramp system because it is already built. It does all the lifting, all the heavy lifting of the programming in a scalable manner that's customized to people very specifically. So I get my coaches all certified with RAMP. It's called being a certified metabolic technician. It's a CMT. It's actually accredited by ISSA, NASM, and ACE now. So yeah,
Okay.
yeah, yeah, yeah. It's a pretty big deal. So I've also, I mean, we're talking about getting into the medical space and things like that. I've made some pretty amazing strides, and I know it's not a huge deal, but that small step is always, or that first step is always very important, right? With the med spas and the hormone clinics,
Yep.
all the ones in my area in Southern New Hampshire, I'm teamed with, and they refer me patients. I call them patients, but members all the time because they know I have a system. I went and I pre-zoed what RAMP is, how it works. I showed them what the life of one of their clients is going to look like once they get to me, and not one time has anybody been let down by that process. So they get check-ins, from their clientele and things like that. And everything that I said we were going to deliver, we delivered, and we delivered it the same exact way for every person. Okay, so that's where I'm saying if we want to get into the medical space, we need to start talking like medical people do, and that's processes that are unchanging.
Right.
Right?
Consistent.
There's no willy-nilly. There is no figuring out on your own. There's no whipping one of these clients over to a trainer. You could give the same person, say you come in my club and you give you to 5 of my trainers. Okay, take care of Adam. 5 different ways they're gonna do that. Now, all of them are gonna have some effect, right? Hopefully, but they can't all be correct, right? There's one method that's gonna be the most correct, right? Or the most um, effective. And and what I've decided in my company, just by watching it thousands and thousands of times, are the people that I put on a ramp program every single time. Positive outcome, positive outcome, positive outcome. Why is that? Because the physiology and the science built into the system makes it almost impossible to fail unless you don't show up. So I'll put out an example. So I'm coming up on about 2,000 people in the just under 2 years I've been using Ramp in my clubs. I offer a money back guarantee to every person that comes in, shows up 3 days a week for their program, and I offer a money back guarantee if they don't get a positive result. And then we use InBody technology to track that. I've given back a refund one time out of all those people. Again, there are people that didn't show up. It's the same thing, just like, gym members
Right.
do is they sign up, they don't show up, whatever. I can only throw a life vest so far, right?
Right.
But the people that showed up for themselves. They were given the the exact same service on intake. They were given the same exact process all the way from opening the door to here's your program, good luck. Now, do you want to do this with a coach one, two, or three of those days a week, or do you want to just do it by yourself? So I've turned personal training into a situation where my coaches with a new client are no longer allowed to program themselves. I've taken that away from them. I've taken the free think out of my clubs because the inconsistency is the it's the biggest problem we have right now is the inconsistency, right? It's
Yeah.
the reputation we have and the reputation personal trainers have. We're about ready to change the term personal training as an industry, I feel like, because it's got such a bad negative connotation, right?
Right.
It's that, but it's due to that wild inconsistency in methodology. Um, the wild amount of online training and cookie cutter training and all these things are just being outed, and who's left holding the bag? Me as an owner.
Yeah.
So I had to do something. Like, I had to take my company back over and say, this is the process that I want to use with every person that comes in and pays me money. I want to say, what is your goal? Here's the process to get that. Here's the outcome, and if that doesn't happen, I'm going to give you your money back. And it's worked very well.
2000 is a hell of a proof of concept.
I agree. And we're doing this now. Ramp is obviously licensed in a couple dozen clubs now, slated for over 100 this year. And that's the reason is I've been able to show that it no longer has to be superstar coaches or superstar salespeople. The process when they come in is a simple questionnaire. I have it 6 questions. Every one of our clubs that licenses Ramp does it the same way. Ask them a series of questions, and it grades them, right? It gives them a point system based on what they answered. Based on that, we turn it over. We say, here's the option that you chose, not the option we chose for you, and not the one we're trying to sell you. Based on your level of need and your goal, here it is. You got 6 points or 8 points or whatever it is. I won't get into the metrics. I turn it over and say, here's your option. Here's the one you chose. And they do it. Amazing. You brought things back to just the most simple form, being like, instead of just being like, well, which option works best for you, right? The goals and all that stuff, all the stuff we did for years. And now it's just, here's the option you chose. And it changes the mindset. It's like psychologically to, okay, I'm making this based on what I need. Rather than going on, followers
Hey,
here that never been
hey,
into a gym.
hold
Sorry, go
on.
ahead.
Go ahead. Now it's fixed. Your mic muffled out.
Okay. Yeah. I mean, where did I end off?
I don't know. I couldn't hear. It was.
Okay. I don't know. So yeah, the process right now, when you come into a club, or the process up until I brought on Ramp was, all right, here's our waiver, sign the waiver, right? And had a couple questions on it that, hopefully tried to sell you personal training or something like that. Something to kind of get you down the road and, hook you into potential sale later, right? They came in, we took them around the club, showed them all the great stuff that we have. That's just like every gym you've ever been to for the most part. Then we come back to the sales table and we say, all right, do you want to do it by yourself for this amount, or do you want to work with a trainer for $1,000 a month? Which option works best for you? Right. So I've changed that model and said, okay, I still have those two options that exist, but now I have, Ramp that kind of runs down the middle that says you no longer have to get a trainer, but when you do, you add a level of accountability. And like I said, I've taken the programming away from the trainer so that they no longer have to worry about that part. They just have to be good people. They have to be attentive. They have to check on them. They have to work on compliance. You know what I mean? Like, it's those things, like just letting them just be good people. I find that now the best coaches with rep, like hairdressers, bartenders, just service people,
Bartenders.
just really nice people that, you like to be around, right? That's all I need now. I don't need some master physiologist, somebody who has every, certification under the sun. I don't need that. I mean, I respect it, of course, but the hero trainer thing, it's not scalable. It's not
No,
scalable. And
No.
and
So
anyone that's watching this that says, "Well, I don't have that problem because I have 75 clients and they all crush it," and it's like, "Okay, I'm talking to you. Come to me. Tell me how you're gonna scale you, right? How am I gonna scale you?" And that's the problem we have, and that's why medical is not looking at us because there's not a there's not a strategy. We're all talking about it. We all know it needs to happen. We kinda know what needs to happen, but nobody's providing that proof, and that's what I'm attempting to do, is just say, "Here's something," right?
yeah,
So, I think that's kinda where I'm at with it, and I will say that even though I'm not a super, super tech guy or anything like that, I gotta say, like, I love what's going on out there, like the pieces that are kinda coming together. A good example is like Alan over at Grow. Love what they're doing over there. I love it.
yeah,
I mean, I think that there's some synergy that is inevitable,
yeah,
with a lot of the things that we're doing, and that's what I wanna do is I'm not some great, leader or operator. I'm not the best on the planet at anything. I'm pretty good at a lot of stuff and all that, but I want to be part of that consortium of brains that comes together and says, this is how we're going to do it. Right. But what we need are people that aren't looking to be the main money maker or create this monopoly or something like that. Like we need to get together, put real brain power together, take all the little pieces, what's good, keep, and what's just not necessary, we can kind of throw to the side, and everybody's just gotta, um, just be able to have honest conversations, like no offense type of stuff where it's just like, well, here's what's needed and here's what's not. And, until somebody comes to me and says, "Hey, you know what you're doing over at Ramp is trash." Okay, like, what's next then? Give me the next thing. What's better, right? So that's kind of where I'm at. I'm so open
it's
minded.
you have given me a couple threads to pull on. First
Okay.
is there's a common thread that's weaving through a lot of episodes where those of us in the industry continue to say we need a space for open, honest conversations.
Mhm.
All the
Yeah.
events, let me rephrase that. Most of the events, most of the get-togethers, most of the
Okay.
seminars are performative.
Mm. Yep.
There's there's very little truly learned and shared. Now there may be things happening in side rooms, sidebars, but there isn't really a hyper focus on let's put a bunch of people in a room. We'll bring brown bags for lunch, and everyone's going to have some open, honest conversations about what works well, what's not working. Here's the three biggest problems we see in the industry right now. Let's all come up with a solution
Nailed it.
because
Nailed it.
this
Right.
pie is so much bigger than the pie that we're all settling for. If we get out of our own way, set our egos to the side, and have some non-filtered conversations.
That's exactly right. I want to be wrong. I want somebody to tell me, you know what,
Yeah.
Eric, I love that you had an idea, but it is wrong. Yes, thank God. Like, what's next? Like, what are we
Well,
gonna do?
it's
You know?
wrong, and here's why I think it's wrong.
Right.
And
And
then
that's
you
what I
can come
want.
back and say, "Oh, I never thought of it that way, but what about this? Oh, I didn't think about that." And
Love it.
but next thing you
My
know,
favorite
we've
conversation.
solved the problem.
Exactly, and, again, I'm not the shameless plug guy. It's just an example of, like, Masa, is our attempt at what we're talking about right now, Make America Strong Again. Not a political thing, so whoever's wanting to think it's a political thing, it's
Yeah.
not. It's just a play on words and
Let the
attention and the whole
dividers
thing.
continue to
What
divide. We're just going to
you
push
know?
towards solutions.
You're offended, I'm not sorry, whatever. It's our attempt at saying, "Okay, let's do something," because everybody's just talking. Like, you go on LinkedIn, and I can't even go on LinkedIn anymore because of the amount of I'm not saying bad, but there's so much chatter, and there's so many, "We met, we partnered, what an amazing event, and what amazing this, and what came of it? I wanna know, like, I'm in the industry, help me," right? Like,
Right.
I want in, right? So
Right.
that's where I'm at. I don't wanna be right. I don't wanna have the only thing. I wanna improve it together. I want the industry to survive. I have 20 good years left in me to really help drive. I'm raising my hand. If you're out there and, you want a workhorse that's gonna go out and, help, I'm in.
Yeah.
And I don't care if it's ramp, masa, whatever. I'm going to keep doing ramp because it's the only thing that I've seen proven to scale fitness to people um, and increase my average revenue per member quite a bit, which is also nice. Capitalistically, I'm not really a capitalistic person. It has done those things, but as we, I guess I'm going into industry problems now, and if you want to save that for later or another time, I mean, there's so many gyms, there's so many boxes now. The infrastructure is there to do everything that you and I are
Yeah.
talking about medically, um, but we're so different in our approach. Like you said, there's kind of 3 boxes, right? Well, 4 boxes. Specialty box would be 1. Number 2 would be HVLP. Then there's me, the poor guy in the middle, and then lifetimes, equinoxes, all that stuff. So
Yeah.
I think you were onto it and you nailed it, and it's the way I feel. And I love having this conversation because I feel like sometimes my thought process might be biased. But I think the biggest opportunity for the medical space is the mid-tier gym because it's not the price war. It's not in the price war. It's not outrageously priced so that people won't even look at it. And it's the one that I think is the most open-minded to conversation and to building something because like you said, the HBLP is eventually going to absorb that middle tier, I think,
Maybe. I've had
Yeah,
conversations
it's
about
hard to
this.
say. Yeah, it's hard to say. I guess from 1 minute to the now, or one day to the next, like I feel differently about that. But I just see like the Crunch Fitness, which is the ultimate HVLP, I guess, in my opinion. They have a little bit of everything. Um, Planet, coming up the ranks with plate loaded equipment, with hammer strength and squat racks. Now they're talking about personal training. That's going to be a disaster, but different podcast, I guess.
Yeah. Well, something you said, I had a conversation recently with Kathleen Ferguson of
Yep.
Coach 360. So,
Yep.
and I think I walked away from that conversation thinking that I think there's going to be a split. There's going to be personal trainers. Now, personal trainers don't take this wrong, but some of you are successful because it's personality driven coaching, but there's a lot of undisciplined programming. There's a lot of personal trainers with, I'll call it lazy assessments. And there's a shit ton of ego-based autonomy in throughout the entire industry.
Hmm.
And you're correct with not every trainer, but a lot of trainers are just kind of out there doing their own thing. There's going to be this split where, yeah, there's going to be personal trainers, and then there's going to be what I'm referring to as fitness professionals or
Yes.
qualified fitness
Correct.
professionals. And these
Hmm.
are what I mean by qualified is they have a level of education, they have a level of certifications, which qualifies them to work within the healthcare medical space, adjacent,
Hmm.
whether that be under a medical director, whether that be under a physical therapist, an occupational therapist, a registered dietitian.
Yep.
There's people who are highly qualified that can give oversight to these qualified fitness professionals.
Hmm.
I want to go back to the 3 clubs. We go
Okay.
in, we have this idea that we're going to start kind of developing and building an MVP
Hmm.
that we can prove works. We've got 3 clubs. Let's say we've got 30 trainers, 30 trainers of what's typical. Now we need to level them up. I want to kind of begin to, from that point, let's first think about RAMP. RAMP is a great tool for fitness operators and personal trainers,
Hmm.
but I'm thinking we can massage RAMP a little bit where it's not a selling tool as much. It can be
Sure.
used on the access side as a selling tool, but on the
Hmm.
outcomes side that we're trying to build into these 3 clubs, it, I think, and that's where I need you to help me understand, because of the way that it's outcomes driven, it's documentation, it's proof, it's measuring consistency, it's measuring effort by the patient, client, soon to be member, let's call them. how can RAMP as a system play into the outcomes based, where we're not using it as a tool to sell in the middle,
Mhm.
but it's
I
actually a tool that allows us to marry up with the medical side?
I think it's already there. It's already positioned kind of in that way on both sides. So Ramp, yeah, I mean, we often say that it's a business solution, which it is, because it solves a lot of the process problems, the intake problems, things like that. It just creates consistency. Like we say, it's a bad way to explain it. We call it a fitness Big Mac. Like no matter where you go, it tastes exactly the same because the process is the same, right? If somebody threw a tomato on a Big Mac, you're like, oh, that's disgusting, right? So, but it's already kind of positioned that way. So I kind of have it intertwined in my whole business where Ramp isn't really the tool that's being used at the front in the sales process or anything like that. It's just saying that when you get to the back and once you become a member, this is going to be the vehicle that drives you from point A to point B. And it's going to be the thing that coaches use to get somebody from point A to point B. I'm not sure if I'm answering your question
No,
correctly, but
it makes
yeah.
sense. I mean, it sounds like it's a plug and play that we can put in place. And with a
Mhm.
little training and education, we could have a personal trainer basically just dot all the I's and cross all the T's, and then use this and pair it up with maybe the EHR system we'd have to implement that's talking back and forth with the providers who are referring their patients in.
And Ramp's set up kind of like an EHR already, just the way it's designed.
Okay.
Yeah. So it
Is there a
looks
CMS
familiar.
built into RAMP, or do we plug it into a CMS also?
No, we don't have that. No.
Okay.
But
So
again, like,
it's,
so Ramp is not its final form, right? It's just we want, getting it to market and proving concept is like, so as we go, improve the system, we improve,
yeah,
everything as we go. So
yeah.
someday it could be everybody out like, where's the app? Maybe it'll be an app. We're just trying to keep it as inexpensive as possible to the industry right now too, which is important. So
There's some discussions in the future, I think, that will be have.
yeah, yeah, yeah. Yeah. I'm
There's an,
sure
there's
everybody I
an,
talk to is like, Eric, we can take this here and there and there. I was like, great,
there's,
love it.
there's an app coming.
Yeah, yeah.
There's MVP being launched right now, and
Okay,
it's all efforts. It's effort.
great.
There's nothing like it that I can't talk about. There's nothing that exists anywhere right now. This is
That's
what
cool.
we've been working on for about a year.
I'm excited to see it.
Dude, I'm excited. I'm
Sure.
excited to
Yeah.
just launch this thing
Yeah,
and
yeah.
watch it go. And yeah, it's going to be pretty incredible. And while building this thing out, the entire time I just kept thinking, because I've had conversations with you and Rocco, how long ago?
Yeah, a couple of years.
So you and guys and Alan from GrowFit, all, even Webster from a
Yeah.
Sensei, all this stuff's in my head, knowing, okay, this is all going to get plugged in as strategic partners to this app because
Yeah.
this app is designed specifically for this space.
I love it. It sounds like probably an app we're kind of working on too, but we lost, yeah, I mean, we just don't have the bandwidth to do.
Yeah,
I,
it's
I think
hard.
I know where you're going. Well, maybe we can talk off camera or
Yeah, I
whatever.
can't talk about it.
Yeah, no, of course. Yeah, the IP, won't anybody take it.
So, I
So
mean,
yeah,
you, so it sounds like RAMP could be part of the operating system that we can plug into the clubs. Where do you think the mid tier has other opportunities?
oh gosh. Hard to say. I mean, it's just,
Well, let me frame it differently. I walk into a crunch. I walk into any HVLP. I want to bang my head against a wall because one of the things I used to rely on heavily when I was acquiring clubs was what I called revenue per workout.
yeah,
So if you got 500 workouts in a day, what's your revenue per workout? That will tell me what kind of culture, what kind of systems, what kind of design did they put into place, and what type of members are they attracting?
sure.
I walk into a crunch, I check in, I go work out, I check out.
Yep.
That's an opportunity lost in my mind every time I walk into an HVLP, because versus in the mid tiers, I walk into a club, the front desk is a gathering area with stools and coffees and
Yeah.
some small meals and pre-workouts and post-workouts and bars and shakes and
Mhm.
juices. And it's like, okay. And my revenue per workout went from HVLP, which is probably in the pennies,
Yeah.
to even $2 a workout. That
Sure.
is
Yeah.
a significant drop to the bottom line.
No, you're right. You're right. I think I just being in it, I take those things for granted, right? It's so hard to get out of your own world
Yeah.
mentally, you
Well,
know?
yeah. I mean, you walk in, you see the same thing every day, and you just start, oh, I didn't even realize that dust bunny was there.
Yeah, exactly. Yeah, I step over them all the time. Yeah, I was just at a Planet Fitness this morning. Like, I can't. It was like, oh my god, you go to Planet Fitness. Like, I can't work out in my clubs. I know everybody, you know. So,
I
but
do. I
man,
get it.
what a weird experience it is to go in there. I'm not saying it's bad. You know, 10 pounds is 10 pounds, but totally different. Totally
Yeah.
different.
But
Yeah.
I mean, so I'm looking at the mid-tier
But I get
space
what
and
you're
I'm
saying
looking,
now with the opportunity. The opportunity is we have the opportunity to say we have the opportunity, honestly, to own the outcomes layer. We're the outcomes kind of tier. I think
well,
we
let me
do have
layer
that
something on
opportunity.
and get your input because I'm thinking it's more than that.
Mhm.
I know
Okay.
high-end luxuries chasing outcomes by acquiring clinics and trying to put a clinic in a club and or leasing space out. That is not what I'm talking about. I'm talking about actual clubs delivering services partnered with providers.
Mhm.
But let me layer this in here and get your thoughts because it's all about the mid tier, I think, is price positioned in such a way where consumers aren't going to balk at ancillary services that come with a fee or and outcomes driven prescriptive services that, oh my God, what do you guys do? I didn't even know. My doctor was giving me this plan. I didn't realize I could just come here
Yeah.
and maybe my HSA, FSA will cover this, this, this. Maybe my insurance will cover this, this, this because it's through my doctor. Holy, holy crap. This is a completely different experience. It just flipped from, well, I'm going to the gym to, well, I'm going to the gym because I've got this to do. I've got this to do. They got that. I mean, it's just a different experience. And I don't see how HVLP can't reposition themselves in the eye of the consumer because the consumers voted with their checkbook for the cheapest, easiest access only club
Mhm.
versus mid tier. People are paying because they want that experience. They want that community. And I will go in and I will spend a couple bucks on a drink or $5 on we know peanut butter chocolate protein shake after that damn workout is the most
The chunky
popular one.
monkey.
Yeah. I mean, and it works. And more, what's even, I see the more opportunity is some of those offerings can meet prescriptive needs based on the provider's recommendations.
Yeah.
And people are going to be able to pay with that through HSA, FSA, or whatever
Spot on.
versus,
Yeah. No, you're absolutely right. And I think it's important to note that the consumer is more aware now than ever of health, fitness, you know, um, what's available. I think more people have studied what's out there. They actually get that there's, kind of three types of gyms, four
Mhm.
types of gyms out there. So we are at the precipice of like this amazing opportunity. It's just who's going to jump in and who's going to do it, and who's gonna have the system or create the consortium, like I was saying, of people that are going to get together and put this thing together. So that's where I'm at.
Well, I'm going to lean on your ramp expertise.
Yeah.
What outcomes can our three clubs realistically own, prove, and deliver on if we're dealing with, because, well, it sounds like you're already dealing with patients. We won't call them patients inside our clubs. We'll call them clients unless they
Client.
become
Yeah.
members.
Yeah.
But what outcomes can we realistically own, especially in that first 12 months? Which ones can we own? Do we want to focus on?
You mean as far as like health metrics?
Yeah, we've got to be able to document. I mean, there's
Yeah.
functional
Right.
deltas that
Mm,
we have to prove
mm.
back to the providers, back to the insurance companies, back to
Yeah.
yada,
Let's
yada,
let's
yada.
go. Let's go. You're right. And it's just like let's really dial in on something, but let's dial in on something that is a humongous challenge, in the country. lowering A1C or something, you know what I mean? Like guaranteed, we'll do that. You refer us a client and we will send them back to you with a lower A1C, right? Let's start there. Some marker, right? Or blood pressure. We're going to improve blood pressure.
Yep.
How are we going to do that? We're going to take some fat off you. We're going to put a little lean tissue on you. Pretty simple stuff. I mean, it's not like it would change how we do things dependent on the ailment, right? Because metabolic health is metabolic health. Like, you know, how we get to better metabolic health is going to be being a leaner person with a good amount of lean tissue on you, right? Like that's really what it is. So there's no rocket science on what's needed to lower A1C and, you know, fight hypertension and, you know, type 2 diabetes and heart disease and things like that. It's all the same protocol to fix those issues, in my opinion. I mean, obviously, you know, you got to get into cardio and, you know, hit training and all that stuff. But
No, I mean, you're right
strength
on.
training is like, if we can say, hey, here's how simple we try to make it, right? So let's just say somebody referred a client to one of our 3 new gyms, right? Intake process, great. Got them in with the option. We're going to put them through a rent program. We're really just trying to get that person to come in and commit to the facility 3 days a week for 30 minutes. We want them to come in 3 days a week and sit down 10 times on 10 machines, right? And do just what your program tells you. We're trying to create a habit because if we can create the habit, we get a long-term member, right? So LTV goes up. When you get a client that comes in, has a good time, has a good experience, they get a good result, they refer all their friends. That's just how that's supposed to work. But again, like that line them up, sign them up, and give them the key tag, end of the relationship. We need to start the relationship at the key tag, right? Or the barcode. So again, there's a lot of layers to this, but to get into that medical field or just to be taken seriously in any way, shape, or form in that field, systems and like let's do some test marketing, right? Let's somehow get to some family practice, right? Say, hey, we're gonna for 12 months, we're gonna take whatever referrals, whatever the metric is, like an A1C over a certain amount or whatever it is, and just start there and just say, we're gonna send every one of these people back to you with a lower A1C. Good place to start.
We're not tracking A1C though. That's up to the provider, right? We don't have an ability
No,
to
no, no,
track.
we don't do it. We're gonna
I mean,
say,
we can do blood
we're gonna
pressure, we can do body fat, we can do
yeah, and that's what
in-body
we do.
results.
Yeah.
Yeah.
But we
Okay.
already know the result of those things is going to lead to a lower A1C, right? I mean, unless
Right.
there's some
But
extraneous
we've got to
factor.
document it so we can
Mhm.
pass the audit, meet regulations
And that's what
so
we're
that
doing
we
with Urban. And I think everybody knows who Urban is at this point, Urban Kieran. Um, Basically just trying to find that one type of client, right? And prove the concept on it. And that's all that needs to be done. Not all that needs to be done, but that's a good, like, it needs to start there.
is Urban going after the medical reimbursement side? Is he trying to
I I haven't spoken to him enough to know the answer to that. I know he's very interested in what we're doing with Masa, with Ramp. He understands how it would work
Yeah.
if it were to work. He understands that it is a, you know, it is a solid foundationally sound vehicle, and then obviously a GPS for the client, you know, to kind of go through the club and get, you know, be doing the right things customized to them. So he sees the viability of it. So I know he's talking about potentially, you know, some type of study in the future.
Yeah. Yeah. Another person that maybe you've talked to him, maybe you haven't, Michael Stackhouse.
Haven't.
He's up at the University of Michigan. He runs or owns a few medical fitness clubs.
Okay.
And he's part of the, I would say, the leading effort in the state of Michigan, but he's also part of the groups that are going to Washington, pushing, I think it's Stackhouse. Afterwards,
Yeah,
I'll get you
I
the,
mean, his page or whatever. I'd love to see
yeah.
what he's doing. I'm so interested in this. I'm so fired up to do something different in our industry.
Yeah. I mean, it's time. It's time that
It is.
something kind of happens.
And I have you, I have Rocco, I have Dennis, I have, you know, Bob over at Next Gen. It's like I got all these guys that are like, for 40 years we've been doing this. And it's like, okay, let's change it. You know, like what can I do?
Yeah. I mean, I think it can be done without turning mid-tier into a boutique high touch model. I
Yeah.
think it can be done without losing what made mid-tier great for so
Yeah.
long and why there
Mhm.
still are millions of members within the mid-tier.
Yeah.
I think it gives mid-tier a path to evolve into creating something that doesn't collapse the margins, actually expands them, and makes it a much more attractive alternative, especially as more and more patients are being driven by their providers into programs.
Yeah.
You know, hey doc, you want me to okay, do what? Where do you think I should go? Is the doc going to say, "Oh, just go to Planet and figure it out for yourself?"
Mhm.
Or is the doc
Right.
going to go, "Well, I already know where you should go. It's FitLab right down the street, and actually they got 5 convenient
There
locations."
it is. There it is right there. Like, you just nailed it. I mean, yeah, Mike Clouds, thanks for the shout out or whatever, but, I mean, there's no way that docs are right, you need to eat better and exercise, right? That's what they're telling their patients. I imagine. I've never heard it from my doctor, so, because I've taken care of myself, but, yeah, go exercise and eat better. Alright, well, how do I do that? Where should I don't know, go to the gym. Then you get to the gym, and it's a wild, wild west.
Dude, you're right. Oh, do you need another beer, by the way? Because remember, we're sitting on the beach drinking beer.
Oh, yeah, yeah, no,
I'll order another beer for
blue
you.
drink for me, please.
Yeah. All right.
I want the headache in the morning. Give me all the
Actually, I quit.
sugar.
I haven't touched alcohol in almost 2 years now.
Yeah, if I drink an old fashioned once a week, that's a lot for me.
I live in Illinois, so I prefer edibles now.
I got you.
I don't
Yeah,
have
my
any
wife's into
problems.
that.
I don't worry about calories. I don't.
I can't. My brain doesn't. I don't know. I get anxiety. I think every time I
Oh, you got
try
to
it.
find the right mix. You got to find the
Well,
right
because my wife
mix.
was like, "Oh, we're sitting on the couch or whatever. Let's like, giggle at each other for a couple hours or whatever." I was like, "I can't. It just control
Well,
issues
that's
or something."
that's fun too. Like, what are
Yeah,
you
no,
laughing at?
she'll get me. She'll get me once in a while. It's like, hopefully, I don't get drug tested, but I'm just kidding. I'm the boss. I can't drug test.
Yeah, no, nobody's testing for that
No,
anymore.
yeah,
We're
whatever.
not operating big
Oh,
equipment
I
or
mean, if I enjoyed it more, and I'm all for it. I think it's fantastic.
so. Let's. I think there's an opportunity, but I want to get your perspective on what I'm going to call cultural resistance.
Yeah,
There's an industry culture. We have both been in this industry for long enough to wonder, is the industry psychologically ready to be accountable to someone other than the member? How do we shift that?
that's my short answer is no, just not. I think there are people out there that are ready for that. There are operators that are ready for that next level. How do we shift it? It's the conversations like this, just non-filtered, just like it's time. If we can't just keep building more boxes and expecting more people to come.
Yeah, they can.
Well, they can expect it, but there's a point, there's a critical mass, point where there's a certain percentage of people that are going to go to a gym. Putting one in their backyard is going to up your chance of getting that member. But I mean, at some point, we have to change the delivery, right? And we have to change the message. We have to change the conversation. I'm not saying use medical terms because the second we use medical terms, we're dead to medicine, So I'm not saying that, but I don't know. I've walked into a lot of purple places. I think I might have been greeted twice in my career. I walked into the orange places and same thing, So we have a long way to go. But I've also walked into a doctor's office and not got greeted, just got handed a clipboard too. But a lot needs to change, and there's an accountability factor that needs to be a part of this. If we're gonna, number one, we're gonna prove it. Number two, we're gonna keep that credibility. Gonna have to be some high level people that are managing that.
Oh, you had mentioned doctor conversations. And
Yeah.
I think, actually, I believe, because I've heard it quite a few times now, GLP-1 has shifted the conversation in that room to where more and more medical professionals, either by their own admission, got up to speed or were forced to get up to speed to
Hmm.
start thinking about, oh, I've got to send them somewhere. I've got to do something more than just prescribe this shot. In
Yeah.
order for this to stick and me to change behaviors and uphold my oath, to the best outcomes of this patient, they need to be on some type of prescriptive strength training and nutritional program. And I just can't tell them to go do it on their own. I guess I could, but no, that won't work. What else is out there? Hey, wait a minute. There's these clubs that have come to us and said, yada, yada,
Mhm.
yada, yada, yada.
And that's what I'm doing.
Yeah. So
That's it.
you've
Like
been out
I have
there.
for med spas and clinics and things like that. That's my clientele. It's all on the forefront. This person's on GLP-1 and testosterone or whatever it is, right? It's just, and that's how it's going. Like just knowing is half the battle, right?
Right. But imagine you're not out there doing that.
Mhm.
You've now, with the 3 clubs, we've partnered with the 5 major hospitals in the area,
Mhm.
because that group, that association, which I'm not going to dive into the complications of how that all works, but
No, yeah,
that
yeah, no,
association of
yeah.
providers sprinkled through all these megalithic hospitals, they're all bought in, and all of a sudden, that's a referral network that just opens up.
Mm.
They've all been through some memo or through maybe some kind of quarterly meeting, been informed, hey, we're now doing this. We've partnered up with these clubs over here. They're going to be providing do, 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 do. They're going to be able to give you feedback, do, 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 do. They're going to be able to sync up. They're going to be blah, 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 blah. And the next thing you know, we're being flooded. Now there's no more, well, are we going to sign people up as members? I don't know how we're going to solve this problem. Now we're getting a ton of clients referred in that we've got to deal with.
Just opened up my
Can
brain and my
RAMP
dream.
scale?
Yes.
How easily?
I mean, as far as bandwidth, unlimited. I mean, it's already it's done. Unlimited programs, all customizable. You can make them. You know, we have ones for. I don't know how far I want to get into this because I don't want to get super off topic, but you know, so osteoporosis client. We literally have a strength routine called osteoblast, right? So it's just like we have it kind of ready, pre-programmed with the ability to nuance, change protocols, customize, add, track, all
Okay.
that stuff. Yeah.
So you
Yeah.
have some prescriptive templates already built in that can be customized based on a doctor's letter of medical necessity and
Yeah.
this.
Shoulder injury and hip replacement and all that stuff done. Just boop, 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 boop.
So we have the systems that are easily scalable.
Very easy. Very easy.
So then it becomes, our bottleneck becomes those delivering the service.
Correct. And that's it right there. And again, not a shameless plug, not a sales pitch, whatever. You keep doing you. If you're happy with your club, whatever. But that is going to be it right there. You nailed it. It's not the that ramp can't handle it. It's the amount of clubs that are going to be ready when and if that those floodgates open. And
Well,
that's what we're trying to get ready for.
I want to go deeper though. I don't know if it's the clubs as much as I keep coming back to personal trainers,
Mm,
and having worked with thousands of them over the years. I'm trying to imagine sitting in a room where, listen, we're going to do this, but you have to understand, we must protect the provider's authority. We must
yeah.
protect, there's no scope creep. We must avoid practicing medicine. Practicing medicine looks like this through your guys' lenses. You can't do this. Oh, and by the way, take the tank top off, because now you have to fit a different mold because there's a different
Mhm.
expectation.
Exactly.
And you go down this list, and I'm seeing some eyes look up and like, oh, they want in, and others are kind of leaning back going, I'm not sold.
Yeah.
And in order for this to scale,
Yeah.
I know RAMP is a simple system where I just need to find the right personality type to plug in, like a
Mhm.
bartender and all that. Because I remember when I used to stand up clubs, often I would put all the resumes over here that had certifications,
Yeah.
and start talking to these that had none, because there
Exactly.
was just a, 10, 15, 20 years ago, some of the certifications like ACE and all that, they'd give them a certification, but they couldn't sell themselves.
Still the same issue
Yeah.
today. Yeah.
Yeah. So I don't know if we can do that anymore, because there's going to need to be a level of understanding and level of certification. There's going to have to be credentialed ACSM people on staff. There's going to have to be,
That's where
and
you were
yes,
getting at. Okay.
payrolls will go up,
Of course.
but everyone's going to be busy.
Oh, yeah. And everybody's
And
gonna be up
prospecting,
and
I don't think prospecting may be for personal trainers, but
mm.
not for qualified fitness professionals. Your thoughts?
I have nothing to add. I'm so with you on that, and now I understand where you're kinda going with this. There is a level of education that is going to be necessary. RAMP is not that education.
It's one of the tools
Learning
they would use.
it's just the GPS, right?
Yeah.
Somebody's gotta you gotta read the directions on how to use the GPS, of course, but somebody needs to, or an organization, and maybe this is, where Kathleen comes in or whatever, I don't know. There's gonna be a level of education, and I mean from a professional standpoint, that these trainers, or technicians or medical technicians or whatever, or metabolic technicians, they're gonna need to be there's gonna be a higher level of understanding, but the pinnacle of that understanding needs to be, this is not your patient. Don't be a doctor. Don't prescribe like a doctor. Stay in your lane. And that is going to be probably the hardest part, in
Yeah.
my opinion. I'm just
Well,
kind of going through with, like, if I was a coach,
this is where it gets weird for me. This is where,
yeah,
because I'm a qualified fitness professional. I'm also a personal trainer. I was a personal trainer before I became a qualified fitness professional. And sure, I can work with a provider's patient as my client and deliver the prescriptive requirements that they've kind of thrown over the wall to me, while also
mm,
adding in some personal training. So it gets to be like, I'm trying to think, okay, if Eric and I and Rocco and some other heads are in a room and we're trying to design a system to onboard our coaches.
yep,
Look, Ramp's a tool. Here's how you use the tool.
yep,
Here's FitLab system that we're going to be deploying, and we're going to train you guys over the next couple of weeks on exactly how to fit within this qualified fitness professional system. And it's structured, it's detailed, it's repeatable. It becomes at scale. Because if let's say the 3 clubs pop, the private equity firm is going to come back to us and go, all right, we're looking for acquisition targets now, and the
exactly.
mid-tier
Yeah, yeah, yeah.
space is ripe. So we've got these 20 clubs spread through these 3 cities. You guys, are you ready? Because you're going to have
Yeah,
100
let's
trainers in a
go.
room for a week.
Yeah,
You see what I'm getting at? Is
yeah,
we
I
kind of
do.
can,
Yeah, yeah. The hardest part's gonna be getting the trainers on board, the mentality of what's gonna be necessary moving forward. It's not really necessarily gonna change their job or their intention, but I think what's the most fun, and again, I employ tons of trainers. I get, probably at this point several hundred under my belt here, maybe 1,000. And the hardest thing to do with the coach is to say, "Hey, I want it done this way." That's been the hardest part, is changing the habits, because you got to put yourself in their shoes. And I even I went and got certified myself, because I was just like, I'm missing something. Like, why do I see the weirdest stuff going on my gym floor, where I'm sitting here like, oh my God, like lawsuits every day, type of stuff, right? Over the years. And I'm like, that severely overweight man is on a Bosu ball doing, squats. And I'm like, why is that? Like, what am I missing? Right. Because I've always been like kind of a bodybuilder. So it's like, all right, let's build the body, right? And never once did I do a Bosu ball, squat or whatever. So I went and got the certification. I was so let down, man. I'm not even going to give you which one it was, because I don't want to, make anybody feel bad. But there was this shiny section about halfway down. It's like building a program. Can't wait to get there. I got there, man. I was so
It's
and that
outdated.
now I understood why coaches are just like at this point, it's to be a good coach, right? You need to be a fun person, high energy, dynamic. You need to give them a cool thing to do so that they want to come back next week, right? That's now their new job, right? So that's why they're defaulted to things like that, where it's like, oh my God, I couldn't do a Bosu ball, whatever, when I came in today. Okay, all right. I couldn't do battle ropes today. You know what I mean? So I think it's been defaulted into like who can be the most dynamic, fun, experience. And I can't blame them for defaulting to
Wow, you bring up an excellent observation that
Thank you.
it just hit me. Um,
Yeah.
the personal trainer space is mainly been designed to sell personal training.
You nailed it, dude.
And what
Yeah, well,
what we're trying to do is we're trying to take people who are conditioned to just sell PT inside of old fitness clubs to work within they can still sell personal training, and they're also going to deliver very strict prescriptive services to clients that can become members who become clients to personal trainers.
yeah, no, I mean, just you're coming around. It's hard because it's hard to orate it because it's like I'm living it, but I almost can't believe it's working. You know,
Well,
it's
I think most people will get it if I say you go to the optometrist and the optometrist has opticians and technicians surrounding them that walk them through the experience. You go to the doctor's office and they've got technicians and nurses all checking you in before you see the doctor. You go to the dentist and you've got this person and that person all. So there's different levels of education and understanding throughout the experience that most of us have when we go to the optometrist, the dentist, the doctor's office, whatever it is. Now we're just talking about that same type of experience inside of a fitness club, a mid-tier fitness club, where now you've been sent here by your provider and there's going to be people who are delivering services to you. And eventually they might become members. And that same person who is delivering prescriptive services might be your personal trainer now, or your
right.
coach,
Yeah,
or your
yeah.
nutritionist, or your
Anything. It's such the opportunity again as you speak about it. You speak about it very well. It's opening my mind a little bit more because it's knowing what's I think is needed, and then somebody kind of to bounce it off of, and somebody kind of giving their perspective. It's now I'm like, oh man, this is a 4 hour podcast, but that has to
Oh,
go
dude,
offline,
I've
right?
been
So it's
working on
like,
this thesis for two
yeah,
years.
yeah, no, and I know you have, and I've seen you over time, and I got to give you some kudos on your non-filtered and stuff I see you put on LinkedIn. I see those little breadcrumbs you put out there. I got to tell you, I've been picking them up. It's fun to watch. It is because you know what, in a crazy world that we live in now, and LinkedIn being the oh man, it's such a weird place. It's like odd forum. Um, just genuine questions and genuine conversations. And it doesn't have to be like, I came up with this and I came up with that, and this is going to be the future and that's going to be the future. It's like, going to be part of the future. It's not going to
Yeah.
be the thing. It might not be, it might be. I hope it is, whatever. But it's like, conversate, let's congregate, conversate, get in a room, talk about things. But, you're on to it for sure. Like
Thank you.
yeah,
I'm trying,
you
man.
are.
I did not when I made a choice a few years back to turn back 100% of my focus to fitness and wellness.
Mm,
I said, this is what I'm going to focus on. It's going to be, I want to figure out how at scale to impact not just thousands, not just 100,000s, millions of people
millions.
through fitness, wellness, and what this country calls healthcare. There has to be some type of symbiotic relationship that is formed and proven out that will work. having worked in clubs, having worked inside of healthcare now, I see it is possible if done correctly. And the heavy lifting is not going to be done on the healthcare side at
Exactly.
all.
They're gonna do next to nothing to
It's
get
going
this.
to be on our side. We
Mhm.
have to level up in order for a provider, a doctor, to take us seriously.
That was for you, Dennis Mathias. He just said it. You're just giving him a little vindication. He's over there like, "What are you guys talking about? Medical meets fitness." Like,
Eh,
we got
eh,
well,
eh,
they're not gonna do anything, you better prove what you're gonna do to them
They're not.
for them.
We are.
We
We
have
are.
to.
And
We have to.
there's
Yeah.
going to be a
Fist bump
select
right
few.
there. You just nailed it, buddy.
Yeah, the provider owns the diagnosis and the medical decision making, and we need to understand fully and bake it in what exactly do we own and what must we never touch,
Correct. And that's
and
the
we,
education level that's necessary that you were talking about before. That
yeah,
absolute must. It's got to be like that oath, that we take.
yeah. And I don't think it's that much of a stretch because, oh, I don't care what level of personal trainer you are or where you're working. If you're not having your clients, the member, fill out a basic medical health questionnaire at the beginning so that you understand where you're even beginning, there you're getting fired. You're getting fired
Yeah,
because it's no
if you were in
different
charge,
than
you'd be firing a lot of people.
the medical health questionnaire was already done by the provider
Yes.
in this scenario. Now they're telling you exactly what you need to do. You don't
Mhm.
have to think about it. You just do. Where your thinking comes in is how can I fit well within this person's personality so that I can impact behavior changes
Nailed it.
and then I can grow this patient of a doctor's into a future potential member and future potential client of mine. That's where it takes people who I think there's tons of trainers out there who want to be able to do this. And
I
they feed off of helping others thrive and flourish. And give me the
lead with
system.
intention, right? Lead with
Yeah.
intention. All my, teachings, that's always behind me.
Well, I mean, dude, we could go on and on, and I don't know.
Yeah, it's
I don't want to
crazy,
go
yeah.
too long with
How do we
you on it.
save the world, right? But you're right. The trainer level is gonna be the toughest level. Again, it's easy at first glance. It's easy to talk about what it's gonna be, but, there's a lot of personalities. There's a lot of things to unknot before we, tie a new bow, right?
Yeah,
We
it's
gotta unteach,
yeah, and I just think it's there, and there's probably trainers sprinkled throughout all of these HVLPs and all these clubs who are excellent and they're looking for this. So I don't think recruitment's going to be a problem because we don't need 100 trainers per location.
Just a few,
Yeah. I mean,
and one of them has 100 clients. Like, how great would that be?
dude, fitness sells access, healthcare demands accountability. I think we could definitely design something that's going to work. If those
For
worlds
sure.
are going to marry, one of them has to evolve. And I think you and I agree. It's the responsibility, the burden is on our side.
Mhm. It is.
So
It's not gonna be medical.
what do you have going right on? What do you have going on right now that's of interest?
Ramps, scaling up, a lot of clubs, slated to have a big 2026 and beyond. My clubs continue to do well. I mean, in a market that, is kind of falling. Again, I follow the HFA and stuff like that. I'm not feeling the same stuff or seeing the same stuff or whatever, but different conversation. But able to keep my revenues the same or a little higher with less members. It's the honest truth. I have less members than I did last year.
Yeah,
Um, but that's going on there. Just really trying to solidify what's going on with Ramp. Really trying to marry Ramp to the Masa mission and not make it. It's not a sales pitch. Like it's
yeah,
just it's saying we don't see anything that covers this gap, right? So we have this system that's doing that very well, and we're just saying this is a viable option. So we're looking to really scale ramp this year, get in front of or a lot more proof out there, a lot more clubs, Masa, we want to grow because we just want the conversation to continue. We don't want the conversation to die. Beyond that, I want to I want to talk to more operators. I want to talk to more visionaries, more people, like yourself, and just really become a voice, one of the voices in the industry that really wants it to succeed. You
Awesome.
know,
Dude, pause
so
right there. I need a Joe Rogan break.
yeah, gotta
I
be.
got to piss so bad.
Yeah, yeah.
Oh, I really
Must
need
feel
to
like a million
schedule these at
bucks.
different times because, man, when it gets to be 11 o'clock, it kicks in hard
Yeah,
because I've already probably downed 4 of these by that point.
yeah, yeah,
Always drinking water.
yeah.
All right. Well, where can people find you?
All over, honestly, obviously in my clubs, but rampgym.com. We got a lot of cool things going on there. You can, look up the Masa mission, what's going on there, makeamericastrongnow.com, to get part of that. But besides that, I'm available on LinkedIn, Facebook, Instagram, anything. Eric Reid, you just want to talk or see what's going on or talk about Ramp. I'm full disclosure with my numbers. I don't care. I want the industry to flourish, and however that's possible, I'm just so in. I'm so in, man.
I love
I'm
it, man.
stoked about it.
Eric, I appreciate you leaning into this with me. I would love to have you back on as a regular. To our
Yeah,
listeners, if
absolutely.
this conversation challenged you or unsettled you or made you think differently, good. That's the point. Non-filtered isn't about easy answers. It's about honest ones. It's about pulling threads that most people are comfortable leaving alone. If you're listening and something here resonated, don't just nod or move on. Think about where this show ends up in your life, your own business, your own leadership. And if it sparks something, please share it. Send it to someone who needs to hear it. Have the conversation that most people avoid because growth, it doesn't happen in a filtered version of reality. It happens here. Until next time, stay curious, stay honest, stay non filtered.
Love it.